All right, it is time to check in with Jeff and Ed once more. Comfortable inside as opposed to being outside. Take it away.
Yeah. We are in the Royal Jubilee Hospital here and asking the health professionals to please save this show. Do you think they can?
They don't have the equipment. They don't have the technology.
Well, that's why we're here. So we're trying to raise some funds through the Victoria Hospitals Foundation, some antiquated equipment, monitors, software that doesn't work with it anymore. So it's quite the campaign. If you're in a position to help out, that's where you want to go, VictoriaHF.ca.
Yep, that's right. And the medical staff, the brilliant medical staff working on that dummy over there. So just the three dummies in the room right now. And Dr. Omar Ahmad is with us as well. And maybe let us know what's going on here, Doctor.
Yeah, thanks for featuring us this evening. We're hoping to raise some funds to replace our monitors that, as you mentioned, are quite antiquated.
Yeah.
They're 15 years old. They no longer have software updates, and they just don't have the capabilities to monitor as we would like them to. But I can talk about the monitors for an incredibly inordinate amount of time, but I think it's more exciting to actually show the monitors in use and for people to get a hand of what's going on. And we actually have a very sick trauma patient that's just come into our simulation lab, and we've got one of our esteemed colleagues, Dr. Thomas, here, and our critical care nurse and respiratory therapy team here. Adam, can you tell us a little bit about the patient in front of you?
Unfortunately, we have a 42-year-old male who fell from a substantial height. He's got devastating injuries to his head and chest. We're really worried because he's quite unstable, so we're starting to prepare to resuscitate him. We've got blood running. We've got all our norepinephrine running to get his blood pressure up. And you can see on the monitor that he's quite unstable. So his heart rate's 147. That's very fast. His oxygen saturations are quite low at 86%. He's breathing really quick, and his blood pressure is really low.
Thanks for that, Dr. Adam Thomas and team.
So those are scary numbers. Those are numbers you don't want to see.
Those are extremely frightening numbers, and it really dictates what we do second to second as we go forward with our management. So we'll follow this case as we go through the evening tonight, and hopefully with this incredible team, I think the patient's going to do quite well. But for now, we've got a lot of work to do, so we'll leave the team to do its work.
Do you need Jeff and I to jump in with anything?
Well, we want the patient to do well.
Yeah, okay.
Isn't that the truth? VictoriaHF.ca, that's where you go, and we can help get these monitors. They need 10 new monitors at about $50,000 a piece, so we could use your help tonight.
All right, Stace, we're coming back from the Royal Jubilee Hospital and the Trauma Center Simulation Center here in a little while.
All right, I look forward to finding out more, guys. We'll see you soon. Thanks. All right, let's check back in with Ed Bain now in our full weather forecast. Coming to you from the Royal Jubilee Hospital tonight. Ed?
Yeah, this is an education for sure. This is the trauma simulation room here, and the crew is busy working on not a real person, thankfully, or I would not be here. I would have fainted by now. At any rate, we're here to help them out to raise some money. And by the way, thanks to everybody who's already donated on the website, VictoriaHF.ca, because they are in dire need of replacing several monitors. They need, is it 10 or 15 you need to replace? 10? 10. This one here is from 2005. So, I mean, in technology, this is Dr. Omar's cell phone. That's how bad it is here. So please get on the website and do what you can here tonight. Coming back with the upside and more about the simulation center. And Dr. Omar here is going to be explaining a pretty involved, I think, routine when we get back here, right?
Correct. Yes, we've got our sick patient here. We're going to check in to see how we're doing. Again, shout out to everyone that's already made some donations for the Victoria Hospitals Foundation, and we really need to upgrade our antiquated 15-year-old monitors. And as Ed said, it's very similar to my old phone technology. Well, it needs an upgrade for sure.
Because when you're in here, I mean, you want the best of equipment operating at all times, believe me. So, yes, thanks, and VictoriaHF.ca, that's the website to go to. All right, Upside is coming up shortly here, Stacey.
All right, thanks, Ed. We'll see you in a couple minutes.
The Upside is brought to you by IBEW Local 230.
Well, given some of the Upside antics we've experienced over the last 2.5 years, I often wish the Upside would be in a hospital setting because I think that would be safer for you both. And tonight, that's where you are.
We're on life support right now, to say the least. But we're in a good spot. We're at the Royal Jubilee. We're in the simulation room right now, and the medical staff is going to sort of show us why we need some of the new equipment we're trying to fundraise for tonight. It is VictoriaHF.ca. If you can help out tonight, we need 10 new monitors here at the hospital. The ones that are in place now are about 17 years old. Colleen Bronson's with the Victoria Hospitals Foundation. And first of all, tell us about the foundation and the work you do.
Yeah, Yeah, so the Victoria Hospitals Foundation, we're a registered charity, and we work with donors within our community and beyond to help fund priority equipment, innovative research, special projects and education at Vancouver Island's two largest hospitals, Royal Jubilee, Victoria General, as well as Gorge Road Hospital.
Good stuff. We're going to find out more about the Hospitals Foundation coming up. We're going to get Dr. Omar Ahmad to sort of show us about this monitor and give us a practical use and show us what you folks do.
Yeah, absolutely. I'm looking forward to getting an update on how our patient's doing and how our incredible team is working hard here. Again, we're representing Victoria General Hospital, which is the trauma center for the island, the referral site for all significant trauma. You guys got the tube in on the ventilator here?
The tube is in. Kayla, can we check another set of vitals for us? And Nat, could we get the second unit of blood in? Yeah. Where are we at there?
And Kayla, if you don't mind, Kayla is one of our critical care nurses. If you don't mind giving us a little update as well, just so everyone can hear where we're at, what we've done so far, and what our next steps are in the management of this critically ill patient.
Thank you, Omar. So we've actually intubated the patient. We've inserted an art line for continuous blood pressure monitoring. As we can see on the screen, his heart rate has improved. He's less tachy, and his blood pressure has also improved. SATs for his oxygenation is up to 100% thanks to the intubation, and we're now able to monitor his end-tidal CO2, and his heart rate or resp rate has also improved.
Awesome, fantastic. And I see Susan, who's our ICU manager at the Victoria General Hospital, just walking in, perhaps with something to say as well.
Yeah, so just a reminder that the Victoria General Hospital serves patients across the island. So all trauma patients would come down to Victoria General Hospital, and that's what we're raising funds for today. And I've just come to say CT scan's ready, and so we're going to put the patient onto our portable monitor and head down to the CT now.
Great, thank you.
All right, and we'll check back in with you folks in a minute. We'll get back to Colleen. Giving Tuesday, that's coming up. Tell us about that and the importance.
It's coming up on November 29th. Giving Tuesday is a global movement. It always falls on the Tuesday after Black Friday and Cyber Monday. Those are 2 days that we're very focused on spending. And Giving Tuesday is also focused on spending, but it's about spending your dollars, whether it's $5 or $5 million, to give back and make the world a better place. I was just going to say, what better way to give back on Giving Tuesday than helping to fund these new monitors for Victoria General Hospital.
Right, victoriahf.ca, and Dr. Omar, we'll get back to you. We got about a minute and a half left here.
Great, thanks. So, Dr. Thomas, where are we at right now, and what's going on?
So the team's down in the CT scanner, and Kayla and I are just noticing on the transport monitor that things are changing down there. I guess the patient's getting more unstable, right?
Yeah, we definitely could probably use some support.
I think we're going to head down to the CAT scanner and join them then.
So what we've just seen here is with our new monitors, we're able to remotely monitor our patients. So even though they're not physically in our unit, they're still part of the team, and we're able to watch them, monitor them from a distance. And what we found now is the patient was initially doing not too bad, but unfortunately there's been a deterioration. So the team has to mobilize, and they're going to mobilize down to the CAT scanner to see how they can help support this patient.
And I'll just finish off with one last question for you. I mean, talk about just, in lay terms, the importance of getting these 10 monitors, which are about $50,000 a piece.
Yeah, I mean, as we can see in this trauma scenario, which is very real to life, don't be fooled by the 3 dummies in the room. But second to second, we monitor the patient's blood pressure, the heart rate, the end-tidal CO2. All these things are so important, and we cannot provide the best care that we can without this information. And they're called vital signs for a reason. They are absolutely vital there, and we call intensive care or critical care critical for a reason, because all these things are critical, and minute to minute they're so important. Yeah, and I think if I wouldn't mind getting Susan back in here, maybe she can give a quick little synopsis on where the patient's at quickly before we end the evening. Thank you so much.
Yeah, so we've seen that we've been monitoring this patient. They deteriorated and now they've improved and we've stabilised them. And as Omar said, we've got minute-to-minute or second-to-second vital signs that staff respond to in the moment to take care of these critically ill patients, and they're trauma, neuro patients that come from across the island to the VGH.
Well, we're in great hands with this great medical staff, so thanks for everything you folks are doing. And at home, you can help out as well. VictoriaHF.ca is where you go to donate, and we'll have more from Royal Jubilee next hour, Stace.
All right, thanks. Sounds good, Jeff. See you soon.
Okay, time for us to check in with Ed and Jeff, who are live tonight inside the Royal Jubilee Hospital. Gentlemen, good evening.
Yeah. Well, and inside's a pretty good place to be tonight. That snow is starting to develop a little bit out there, but we'll talk more about that as we carry on. Yeah, it's an interesting night here tonight at the Royal Jubilee.
Yeah, we're in the simulation room. A lot of smart people in this room.
Smokes,
and us.
Yeah, here we are trying to blend in. It's not working. Anyway, this is a fundraising night here for the Victoria Hospitals Foundation. They are in need of 10 new monitors. These are from 2005, Doctor?
2005,
This is
that's
Dr.
correct.
Omar Ahmad here, who's going to be demonstrating a simulation for us here shortly. But that's the drive tonight. So victoriahf.ca and help you get these new monitors. Oh, and the surgical. I hope you don't mind me pulling out some of the surgical tools. I mean, that's how bad it is, right? This is some of the surgical tools they're using. So, yeah, we need all the support we can get. That was a bit of a stretch for that one, wasn't it?
Well, you know that was supposed to be sterile. Now you've just contaminated
Oh,
it.
that's right, yeah.
So I don't know.
Yeah.
You know, like you said, we've got 3 dummies in the room and plus the mannequin in the back here. So
what are we doing here? We've got a simulation.
Yeah, well, first of all, thank you so much for featuring us tonight. And yes, as you said, we've got antiquated monitors that we desperately need to upgrade at Victoria General Hospital, which is our trauma referral site for the island. And we can talk about the importance of monitors, but I thought we would start off by actually showing how they work in real life. So here we've got our incredible critical care team. And just going to ask Dr. Thomas what's going on. I understand, Dr. Thomas, you have a very sick trauma patient here. Can you tell us a little bit about this patient and what the plans are?
That's right. So this 42-year-old male has a polytrauma. He fell from a great height, and he has obvious devastating injuries to his head, face, and chest. We're just setting up to get him on a breathing machine. The team's getting blood into him as fast as we can. And Omar, behind you can see on our monitor that he's quite unwell. So his heart rate's 147. His oxygen saturations are critically low at 85%, and his blood pressure is critically low at 59 and 46. He's quite sick.
That is a very, very unwell patient, and these vital signs are extremely important for us to be able to monitor second to second.
Yeah, well, the simulation center is vital to the training of all the staff here, and so we're going to find out more about that on the upside as we carry on here tonight. But thank you, Doctor, and the great team you've assembled here, and we'll look forward to the upside and showing a more of a detailed operation. Not really operation. It's, what's the word I'm looking for?
Not with the tools that you're using anyways.
Not with the tongs, no. The tongs won't be involved. Let's just say that. That's a good thing.
I know Dr. Ahmad can't hear me, but if he could hear me, you should let him know. Just smack the guys if they touch anything, Dr. Ahmad. Just give them a nice smack.
Right. Yeah. Joe says, feel free to smack us if we're touching anything we shouldn't be touching. So, at the end, if that's the case, by the end of the show, we may be checking in here.
Yeah, really.
All right, that was great. More from Royal Jubilee as we support the hospital and the doctors and all the people that do great work there. Thank you, gentlemen.
Boy, this is quite an education here tonight. This is Dr. Thomas, and this is our dummy here that we're working on here in the simulation center. What is this tool? This is like a scope of some kind, right?
Yeah, it's a video laryngoscope. So we use it to see the breathing cords, and you're going to pass that breathing
I'm going to pass it, and you sort of help me pull this off here so you can see it all right there on the screen. So I'm going
right in the middle.
Right in the middle, and I'm going down.
There you go. You see the uvula?
Yeah, there we go. There's the uvula.
Keep going in the middle.
All right.
Aim until you see the breathing.
Okay.
Perfect. Those are the vocal cords.
All right.
Grab your tube.
And the tube goes
just that way. Excellent.
This way here, and I got to find that sweet spot, if you will.
Turn it 90 degrees, and then try to get right up there. So
close. Oh, is that close? That's not 100%, but it's in the vicinity.
It's close.
Of course, you don't want to be in the vicinity, I don't think, in medical terms ever. No, you want to be right on the money.
0 for 1 for now.
Yeah, that's right. Well, we'll leave the doctrine to you. Although I have the handwriting of a doctor, as you might know. But this is a very interesting night tonight. They're trying to raise some money for some antiquated replacement of some equipment that they need to replace. 15 or 10 monitors that are really dated, 15 to 17 years in age. So if you can go to the website and make a donation, they'd love to get that tonight. victoriahf.ca.
The Upside is brought to you by IBEW Local 230.
Okay, Jeff, pretty special night as we get to learn a bit more about what happens inside the Royal Jubilee.
Yeah, we are with a great medical staff right now. It's a simulation room, and Ed and I are learning a lot tonight. We're also learning that we need some new monitors. In fact, 10 of them, and they are about $50,000 a piece, so we could use your help this evening if you can. The website, again, is victoriahf.ca. Thanks. You saved my life, Ed. I appreciate that, man.
That's what we do here.
Colleen Bronson's with Victoria Hospitals Foundation. Giving Tuesday is coming up, a really important day at the end of the month. Maybe tell us about that, Colleen.
Yeah, for sure. Giving Tuesday happens on November 29th this year. It's a global movement, and it always happens on the Tuesday following Black Friday and Cyber Monday. So those are 2 days that are really focused on spending. And Giving Tuesday is also focused on spending. It's about spending, whether it's $5 or $5 million, on giving back and making the world a bit of a better place. And why not give back to the hospital foundation and help fund these new monitors? Yeah,
love that. That's for sure. And we're going to find out about these monitors and why they're so needed. Dr. Omar is going to sort of walk us through what we're doing here today. Doctor?
Sure, sounds great. So we'll go back to our patient here. For your listeners, don't be frightened. Ed wasn't actually involved in doing that, but the patient is doing better, I think. We're going to hear from the team here. Dr. Thomas has just intubated. Chantel, our respiratory therapist, has just set the patient on the ventilator. And Kayla, can you give us a little bit of an update as to where they're at and what the next plans are, please?
So as Omar mentioned, we've intubated our patient and inserted an art line to do some continuous blood monitoring. Using our new screen there, you can see that our blood pressure has improved, as well as our heart rate has improved. We're now satting, or our oxygenation is 100%. We're now also monitoring end-tidal CO2, and rest rate has improved as well. And again, this is after we've given them a bunch of blood products and a lot of other interventions.
And our end-tidal CO2 is super important. It's not something that we could monitor on our current monitors, and it's very important for patients who have a traumatic brain injury like our patient here. And our respiratory therapy colleagues, such as Chantel, really monitor that closely, and they adjust their ventilator, and that's really something that we do second to second. Oh, and here we have our VGH ICU Manager, Susan Butler.
Hi, I'm Susan Butler. I'm the manager for the Victoria General Hospital. We're fundraising for the Victoria General Hospital Intensive Care Unit. And Omar, I came to tell you CT scan is ready. The patient's hooked up to this monitor, but it has the portable monitor here, and we'll go down to CT scan on that portable monitor.
Great. All right, let's get moving, team.
All right, we'll get back to what the medical team is doing here in a second. I'll bring Colleen back in and maybe just talk about the importance to, funding hospitals right now and going to victoriahf.ca and donating.
Yeah. So in the beginning of the pandemic, we received just an overwhelming amount of support for our hospitals and our care teams. Now we're 2.5 years in, and much of the world has moved on, but sometimes here in the hospitals, it's still really challenging, and we still really need that high level of support from our community. Jeff, you might not know this, but 40% of the equipment at Royal Jubilee and Victoria General Hospital is actually funded by our community. It's funded by our friends and our neighbors, and their support, or your support, means that we can get new equipment like these monitors, new state-of-the-art equipment, much faster than if we relied on government funding alone.
Good stuff. Let's get back to Dr. Omar. Take it away.
Okay, great. Thanks so much. And so the patient went off to the CAT scanner, and we were able to monitor remotely, which is super important and something we couldn't do with such great capability previously. And it really changes how we monitor patients and provide increased safety. So the patient went down to the CAT scanner. The team was up here monitoring. Unfortunately, the patient deteriorated, and we were able to mobilize the team down to the CAT scanner and make him get and work on some significant resuscitation maneuvers that made the patient feel a lot much improved from a physiological standpoint. Susan, again, our VGH ICU manager, do you mind just giving a quick final synopsis of how the patient is doing now?
Yeah, the patient's doing quite well. We can probably see, if you step aside there, Omar, that his vital signs have stabilised. So the staff monitored the patient, and in minute-to-minute decision-making, they adjust based off what this monitor tells us. And the patient's doing quite well, so back to the Victoria General Intensive Care Unit for this patient.
And despite having Ed trying to pre-operation, this patient has done very well. So thank you so much.
Let's just wrap it up with this. How about, shout out to the great staff here. We actually received a really nice email that just came in a few minutes ago.
Yeah, this is from Scott. I'm just going to read this because I think it really sums up the important work you're doing here. He says, fellas, I was there in 2016 after a car hit me and my dogs on a sunny July day. I needed 40 bags of blood, was bleeding out, and the fantastic folks on the trauma team saved my life. He said it's not possible to show the real life urgency and blood, but I am proof that the trauma team are second to none, and I love them for my life. And that's from Scott. So that says a lot right there. So you're doing vital work for sure.
Hats off to all you folks. What a great team, and thanks for having us here today. Again, it is victoriahf.ca. Give if you can. We need 10 new monitors stat.
Right, victoriahf.ca. So these old monitors, these got to go, and the new ones we got to move the 2022s in.
Yeah, that's right.
I think there's a direct correlation between a well-executed upside segment and doctors being involved. Don't you think?
Yeah. As you can tell, the upside's on life support right now.
That went really well. I mean, that was fantastic. That was really good. Hopefully we can raise some money and help them out.
Come on, Joe.
No, it was. Yeah. Thank you, guys. All right, we'll take a break. More news when we come back.